Namaskar viewers, hello and welcome to Sansad TV. I'm Teena. You're watching the global debate. In Spain, women now have the option to take menstrual leave each month if they feel uncomfortable during their periods. Spain's parliament approved a law this week giving women the right to a 3-day menstrual leave of absence with the possibility of extending it to 5 days for those with disabling periods which can cause severe cramps, nausea, also dizziness and vomiting. Spain's Equality Minister Irene Montero said the decision is momentous, not just in terms of women's health, but also towards combating stereotypes and myths that still surround periods and hinder women's lives. So with this law, Spain becomes the first European country to allow paid menstrual leave, although globally similar policies are in effect in countries like Japan, South Korea, Indonesia, Zambia and Taiwan. What does the law in these countries say? Is the benefit being availed by women in these countries, or has it further stigmatized menstruating women, as is claimed by critics of menstrual leave? We'll try and get answers to all these and much more on today's edition of the Global Debate. To discuss their views on the menstrual leave policy, the debate around the law granting paid leave during periods, and the taboo around menstruation, I have with me three distinguished panelists. So let me begin the program by introducing them to you. Delighted to have with me on the broadcast today Ms. Khushbu Jain, Advocate, Supreme Court of India; Ms. Ruth Kanyanga Kambi, Senior Journalist, Communications Expert and Women's Rights Advocate, Lusaka, Zambia; and Dr. Trupti Gilada, Infectious Diseases Physician, Unison Medicare and Research Center, Mumbai. Thank you to all my panelists. Welcome to the Global Debate on Sansad TV. Ms. Khushbu Jain, coming to you with the first question. What is your perspective? Is menstrual leave a privilege or a basic right that should be given to women?
To start with me, I think it's a basic right which should be given to the women. And to elaborate a little more, see, we have to look into that. We need to understand the aspect that there has to be an inclusion of women and men equally. There has to be a gender equity at work. There has to be a workforce participation. There has to be an aspect where we raise question regarding women's health, and we take that into a consideration. It's high time. If we look into the numbers, India today, I'm restricting myself to India, and I think the same numbers will follow across world. But if we restrict India today, out of 135 crore people, roughly 90 crore are working in age bracket. And now out of that 45 crore are the women. Now, if I look at that 45 crore women, labor workforce participation rate of India I'm talking about, there is just 20% which is working, and rest of the one which is not active. So to look into this, I think that this kind of a move will also help, that it will foster, or it will make a space for women to participate in the workforce more and find themselves more inclusive in the work environment, and there is a parity or equity at the workplace. So I think it's high time that this kind of, the part when we talk about body, there has to be a body inclusiveness, and we need to give recognition. We have panelists, co-panelists as doctors, which will talk more with regard to biological aspect of women and men, and what kind of impact women go through medically or scientifically in the body when you talk about menstrual cycle. So I think it's the high time that we have to talk about. It's not just the people at the unorganized sector, but also I am talking about, if I tell you some stuff, there are women who are working in women workers who are working in urban sector who use public transport such as train, metro, buses. Now, traveling by public transport, standing in room for an hour or more, rushing towards the changing room, rushing the trains in between and not finding the proper changing room, I think it makes it very difficult, or these are the circumstances which make it very difficult for women to work. And this has made it a stop, in a way, a stop for significant increase in the women workforce.
Right.
And this has led to a discomfort experience during the menstrual cycle. So I feel it's a welcome move. and it's a must now. How we should create a policy, I think we can discuss it later, so that it doesn't create more of a con than the pros.
Absolutely. I mean, even today, if it triggers a wider debate, of course, there are 2 points to the debate, and we'll take that forward in just a moment. But Dr. Deepti, coming to you to understand what is your opinion on the entire subject of menstruation leave. So Spain may be the first European country to do so, but there are a handful of countries globally who have had this provision, although the response, will come to that also later, that there are women, of course, who themselves do not want to avail the benefit because of multiple reasons. But from a medical point of view, do you think periods leave is something that is the need of the hour, and more countries should be having a policy which allows for paid menstrual leave?
So if we were to talk about the medical aspect and even otherwise, there is no doubt that menstrual leave is a basic human right and is the need of the hour. But what we need to understand is that these strategies will need to be brought in very contextually, understanding the culture of the country or the culture of the region. So we know, and so we had done a quick survey after Kerala gave the policy that they would have menstrual leave in universities and colleges. And we asked few women here if they would avail menstrual leave. And what one thing was clear was just calling it menstrual leave by itself could lead to stigma.
Right.
And when we talk about equity at workforce, menstruation is not the only issue that women need leaves for. The leaves could be for someone ailing at home, childcare leave, and calling the menstrual leave, not just menstrual leave, but calling it a healthcare leave would allow women to avail of those leaves, either it's for menstruation or for any other health issue at home, because we understand that menstruation as itself is a taboo. Women will not want the others at work to know that they're actually menstruating during those days. And just calling it menstrual leave might add to that taboo. In fact, women are afraid that when they take leave for any other reason, that leave will be called a menstrual leave. So yes, menstrual leave is important and is the need, but calling it menstrual leave in our Indian context might not be the best way. It might just backfire, and calling it a healthcare leave might be the better way of doing it and making sure that, yes, women get their right and in a more dignified way.
Okay, so coming to you now to understand what the situation is like in Zambia. So with Spain bringing in a law on paid menstrual leave, of course, it's triggered a global debate. And Zambia is one country which has a similar policy in effect since 2015. Ms. Ruth, tell us about what the law on paid menstrual leave talks about in Zambia. What is the kind of response that it has seen over the last 8 years or so? How comfortable are women availing these paid menstrual leaves in your country?
Okay, well, thank you very much. It sounds like a loaded question. I'll try by all means to break it down as simply as I could. So, like you have alluded to, the law on menstrual leave was effected a few years back. And it requires that every working woman gets 1 day off every month when it's that time when they're having their menses. And it's been accepted, though with a few challenges for government institutions and parastatal institutions. It's a little easier to implement that law, because obviously the law was formulated by government and related stakeholders like the Zambia Federation of Trade Unions and the Zambia Federation of Employers. So it has been a lot easier for government and government agencies to kind of implement the law. But there is a challenge with implementation when it comes to the private sector.
I'll come back to you. But the larger point that both Dr. Deepti and Ms. Ruth have made is the fact that it's not just a medical issue. You extend a benefit which women will be willing to avail. The larger point here is around the taboo surrounding menstruation. So in Zambia, it is referred to as Mother's Day. In India, there is a state, Bihar, which has a policy for the state government female workforce since 1992, but it doesn't refer to it as a menstrual leave. It calls it 2-day special leave. So, Ms. Khushbu Jain, the point here again, and which makes the entire topic very complex, is that the taboo around menstruation is something not just in India, but globally. And this is something that cannot be, fought just by extending 2 days of leave to women because you think it's medically, going to be beneficial for them. It's a 2-day rest that women will be willing to accept. So the taboo around menstruation is so huge that women themselves are not willing to avail this benefit. So even if we have a universal law, a national law, say here in India, we really don't know how many women will be willing to avail that benefit in the name of menstrual leave.
I absolutely agree with you, and I think the tone is set right, that menstrual leave policy, though it is well-intentioned and a progressive move, could have a negative consequences for gender equity, and hence it need to be deployed with caution. And when I say caution, I think those maybe by having a conversation about menstrual cramps and their effects, people who menstruate may feel more comfortable discussing their health with their employers and other staff members. This, in a way, can eliminate stigma around menstruation, can also boost our well-being and increase workplace productivity and companies' loyalty. Now, those who still don't feel comfortable openly about these things, for example, there are certain set of people who don't feel comfortable. Hence, I would say that an open conversation about these things will make people more comfortable. And if I make quote that there are some companies apart from the states which you were narrating, there are some companies who have implemented
yes.
Menstrual leave, and there if you would see that that people who are not even attracted, or people who are not even benefited by this leave, are also in support because of the communication that has come up, because of the awareness that has been implemented around. So it has been found that even those who don't menstruate, they support this idea. And they also talk about that this is an idea which is nothing but it promotes looking after one's body and adjusting one's working day to suit that part. So I think it in a way, creating more awareness about it, removing the taboo it has along with it. But there should be a level where we should be open to talk about it rather than calling it a sick leave or something. I understand that today is a situation where it is a very good stopgap arrangement, where we, instead of calling it a menstrual leave, we can call it a sick leave, and we can include that in the sick leave so that people still feel comfortable and start taking that. But I think
the question here, Ms. Khushbu Jain, is also about the fact a lot of people who have opposed it, and Dr. Deepti is a better person to throw more light on this contention that's been argued, is that it's a normal biological process. So if it is categorized as a special sick leave, Dr. Deepti, it is in a way leading to some kind of subtle discrimination, something that women will further be uncomfortable about, and that perhaps should not happen. Do you agree?
Even though it's a biological process, we know that over 1/3 women really experience a lot of pain and discomfort and mood fluctuations during those days. And that pain and discomfort is biological too, but it's uncomfortable. So we might not want to call it sick leave because it's not sickness, but it actually makes the women feel sick during this period. So just trying to say that this isn't warranted because it's biological and people aren't actually sick is just a way of saying that we really do not want work equity. So what's important is, the menstrual leave really needs to come in hand with a lot of other strategies. Just bringing in a menstrual leave and saying that that's what we're doing for gender equality at work is not going to be enough. It needs to come hand in hand with work flexibility for women. It needs to come hand in hand with clean toilets. We might be talking about corporate offices, and those are very well equipped with toilets. But we know that small scale industries and a lot of workplaces really do not have good hygienic places for women to go to the toilet. So all these aspects need to be taken care of. And talking about sick leave at work is a change at later, but all these things need to begin at grassroots, where We are talking about menstruation openly, even with teenage girls at school and teenage boys, because they need to understand is that while they're growing up, menstruation is just normal. It needs to be normalized as any other process in the body. So starting very early on to actually change the attitude around menstruation is going to be important and is going to take several years to get there. But and this is like a great place to start, at least start that discussion about menstruation.
Ms. Ruth Kamvi, how has the experience been in Zambia? Because is it just a taboo that women are uncomfortable around? Or is it also the fact that in this age of cutthroat competition, we are somewhere worried that maybe one day of leave would cost us a lot of other things that we deserve in our jobs? So maybe 1 or 2 days of leaves would cost us promotions. Maybe our appraisals are impacted by that. What has been the situation in Zambia? Because what we've seen in Japan and South Korea, there have been surveys conducted over the years which say that the usage of these leaves have dropped significantly. And this could, of course, not only be attributed to taboo. This is a lot more than just the social taboo.
I'm glad you've mentioned that most women would not want to take their Mother's Day or menstrual leave because they feel that they'll be affected by obviously not being promoted at work. Just a day of absence from work will affect them in that manner. And for Zambia, we haven't had any survey that has been conducted regards how this has been implemented, but just conversations with fellow women from different industries, that is one issue that they are concerned about. And they say that in most cases, men would give them that menstrual leave as compared to their women supervisors, because men want to take advantage of the fact that they are absent from work, and then they'll do the work on their behalf, which actually disadvantages them from getting certain privileges, and also from just getting ahead of the men. So sometimes it's not even because women are denied this menstrual leave, but it's because they feel that they'll be left out and they will not get the benefits of them having working every day of the month. But it takes a toll again on them because the doctor has said, this is a day, or these are days that come with a lot of challenges, a lot of discomfort, and you find that in certain workplaces, it's not really conducive for a woman to work during these periods. So women kind of are not effective. They don't give it their all when it comes to performance, because every now and then they are cautious of how they are looking, how they're going to manage themselves, and all that. But again, also there's the cultural aspect. When, like here in Zambia, when you are having your menses, this is not something that everybody should know about. And if you have male supervisors at work, you obviously do not want to share that information with them. So it becomes a little bit challenging again to just open up and say, I'm having my menses. This is a biological thing, and I feel that everyone should be free to talk about it. But the cultural aspect also contributes to the fact that women do not want to come out and say, I'm having my menses and I cannot work effectively. Yeah.
She's speaking from first-hand experience. Zambia has a law. Ms. Khushbu Jain, the advantage of this law is that it does not normalize the kind of unbearable pain that women have to go through during periods. But the biggest disadvantage is that we may lose out on, a lot of other things if we are availing the benefit. As it is, women at workplaces face subtle discrimination for the fact that they're spending or they're utilizing a lot of their energy in childcare, in the other domestic responsibilities. So by availing these menstrual leaves, of course, it paves another way for the subtle discrimination that we already are facing. the question is, what really is the way to go? So we would say that for countries where there is no law, perhaps there is no benefit for women. But for countries where there is a law, they are not availing it for multiple other reasons. For a country like ours, where it varies, and it depends largely on a lot of our cultural beliefs also, will availing menstrual leave upset the cultural norms that we have been so rigidly clinging to and following generation after generation?
If you talk about cultural norm, the cultural norms were much better. The cultural norm were on the aspect that women being working at home were given 4 days of a leave so that they don't have to work. So I think the way it continued and people started putting a stigma to it, untouchability to it,
Yes.
is where I have an objection. But if you talk about our culture was very much aware about the aspect where women go through the pain, the women go through the kind of undergo the kind of situation during those 4 days. They understood that aspect and they brought in that aspect into a system where women could take off 4 days from the work in the house, doing household chores and other things. So I think I would not go on culture aspect to it, but what we have created today's world is the talking about untouchability and adding a lot of myths to menstrual cycle is where I would say that with countries with no law or kind of things which you're talking about, one is awareness. The second that comes is you can have alternative to menstrual leave. Menstrual leave can be an optional thing for the people who want to avail, who are going so much of a pain that it becomes uncomfortable for them to travel. There can be an optional work from home. There can be more provisions. There should be more inclusivity in the offices, such as creating a restroom so that they can keep on taking breaks and they can lie on bed, and work from home is another thing which can come. And I think when law comes in place, today is the situation where there is no law. When law comes in place, I think the things will turn around and make changes. I understand the drawback it will come up, but I think one has to understand it's not a whims and it's not out of wishes of women, but it's a genuine need which women's body need and require. It's not that we are calling for. So I think apart from women, men have to be taught more about what kind of physiological changes women go through and the pain women go through during this time, and how that should be incorporated in the workforce. And if I talk about, women have been very instrumental whenever they are working, the kind of output they give compared to men. And there have been studies. I'm not boasting about that part, but there have been studies. I can see the smiling faces over here. But there have been studies where women are working, the kind of output the women put in compared to men. So I think it's high time that we need to understand the biological need at the same time, and consider that and bring in the environment, not a compulsory sick leave.
You know, to all of us women who go through that unbearable pain, Dr. Trupti, it would seem as a welcome step. But to imagine the agony that's inflicted upon you by your employers, who suddenly, decide to, or they prejudge you because you took a special leave and you decide not to come. They equate it with your productivity. Perhaps, and you would remember when the maternity law in our country was passed, which provided for 6 months of paid leave to women. A lot of private companies stopped hiring women between the age of 25 to 32, which is, the peak productive age of women. And it became a huge concern. There were lots of young women who would say that they were either made to sit on the bench, because of which you would obviously quit, or they would make, the environment so unfavorable for you that perhaps you would, resign and look for better options elsewhere. The question is, if this happens for maternity, where you are, producing a child, what happens if you avail 2 days or 3 days or maybe 5 days, as the Spanish law says, every month? What is going to happen? What is the kind of agony and the pain that it is going to bring to you from the employer's side? Not everyone is lucky to be working in a Zomato or maybe in other companies which are offering you that kind of benefit.
So we understand that it has both these sides, but just having that downside shouldn't prevent us from still having this policy. It's definitely needed. What we need to work on is how do we strategize it? Right. And that is where all our energy should be going to. In fact, we should have this law and then have law against discrimination against women. And that law should be stronger, where, if women are discriminated against, be it on their pay scale, be it on using leaves, then there is a disincentive for the employer for doing that. So there needs to be this law and some protection for women to use this policy. So it's definitely needed. I think we are ready to have it. At least in the cities, menstruation is becoming lesser and lesser of a taboo, and it will require a few years. It's a mindset change. Mindset change is never easy. It will take a few years. They will see the benefit of having that leave and having more work efficiency when women are present. The loyalty towards the workplace when they're allowed that 1 or 2 days of sick leave. They will see the benefit of doing that, and things will come around in a better way.
So in India, we don't have a law as such yet, Ms. Ruth, but we're hopeful that whenever there is a policy and we need to strategize it in a wise manner, as Dr. Deepti suggested. But how is it in Zambia? Has there been a mindset change on all of these aspects that we've spoken about? So number one being the taboo that is attached to menstruation, the kind of discrimination that women may have to face at workplaces, and the negative consequences that critics often talk about in terms of reducing female labor participation because you've availed these leaves. So how has Zambia responded to all of these factors that we just discussed on the program?
Yes, I think a lot of strides have been made by different organizations that champion menstrual hygiene and menstrual leave and Mother's Day to ensure that people change their minds as far as this is concerned. And we've been seeing in the recent years, we've been seeing a shift when it comes to how, more especially the men, have interpreted this law is concerned. I had a conversation with a few colleagues, male colleagues who employ women and are supervisors to women. And they say that one thing that they are not comfortable with is the fact that women should actually communicate a day before, or they are required to communicate a day before that, or tomorrow I'm not going I'm taking my special leave, because probably I would have started my menstrual leave. They say they are not comfortable with that. They would rather, when somebody starts their menstrual leave, the very day, that's when they just send in a note that I've taken my Mother's Day today. So there's been a lot that has been happening. But like I mentioned earlier, it's still a challenge because there are certain people that feel when a woman stays away from work as a result of their menstrual leave, as a result of Mother's Day, then they are stealing company time. But the law says that this is not a day that should be accounted for in terms of pay to the employee. The employer should account for this day. The employer should pay for this day. But slowly we are getting there. It's been 8 years, and I wouldn't say it's been a success so far. There's still a lot of things to be done, and a lot of people, champions, are doing what they could to just ensure that everybody comes on board. There are so many stories, and more especially from the private sector, where sometimes women are even chased from work. Like, you take a day off today, the following day you report for work, and your boss just says, you're not serious with your work, so just go back home and come back when you feel you're okay. Sometimes it sounds like a joke, but it also borders on employees' rights, human rights, and women's rights. At the end of the day, it's a gender issue that has to be looked at for everybody to really just accept that this is law and it has to be adhered to here.
Absolutely. I think that's a very valid point. The policy or no policy, what's important and the bottom line is that there has to be a mindset change, not within specific countries, but globally. And the fact that this is one step towards gender parity, a lot more needs to be done. And that will happen only through transformations, effective transformations in society. So that having been said, I'll have to wind up the program. Thank you, Ms. Khushbu Jain, Ms. Ruth Kamvi and Dr. Deepti for joining us on this edition of the Global Debate, sharing your thoughts, your views with us and our viewers on this very, very interesting subject. And to you viewers, thank you very much for your time as well. I'll see you same time next week now. Take good care of yourselves. Keep watching Sansad TV.